Good morning everyone. This is Cholokpal, General 22nd page. Select. Today we'll discuss about the parietal bone. This is the parietal bone, left-sided parietal bone. First, আমাদেরকে যে কোনো ব্যাপারে জিজ্ঞেস করা হবে এটার anatomical position. What is the anatomical position? First we will say that it is a left-sided parietal bone. First point is the superior or sagittal border lies in the medial plane and the the sphenoidal angle is directed downward and forward, and internally it is marked by the groove for middle meningeal artery or vessels, and external surface is convex and smooth and marked by the parietal tuber. This is all about the parietal bone, parietal bone's anatomical position. Now what are the features? Or next question is about the middle meningeal artery or vessels. Middle meningeal artery is the branch of maxillary artery, and maxillary artery is the branch of external carotid artery, with the other branches of external carotid artery and the lingual, facial, maxillary, superficial temporal, and occipital artery. And external carotid artery are the branch of common carotid artery, which is the branch of arch of aorta. Now, next question: the cross structure of the parietal bone is outer, inner, compact, and intervening diploid. What is the intervening diploid? It means it contains the diploid vein. That's why it is called intervening diploid. And what is the type of bone it is? It's a flat bone. And nature of ossification. And this nature of ossification is intramembranous. All of the bones of the skull and clavicle are intramembranous, and other bones are intercartilaginous, except there are two intercartilaginous bones also in the skull, the inferior nasal concha and ethmoid bone. There are some mixed ossification of the bone in the skull, like we'll recall it like with the mnemonic of most: mandible, occipital, sphenoid, and temporal. Now, presenting parts: it has two surfaces, external surface, internal surface, four borders: superior border, sagittal border, anterior border or frontal border, inferior border or squamosal border, and posterior border or occipital border. There are the four borders. Now, features of these four borders: this is the superior border, sagittal border articulates with the opposite side of the parietal bone and forms the sagittal suture. And in the anterior frontal border articulates with the squamous border of the frontal bone and by the coronal suture. Inferior border, which is known as it has three parts: anterior part, medial part, larger medial part, and posterior part. Anterior part articulates with the greater end of the sphenoid, middle part with the squamous part of the temporal, and posterior part with the mastoid, posterior part with the superolateral border of the occipital bone, and posterior border of occipital bone, which articulates with the occipital bone by the lambda suture. There are four angles: anterior superior angle, anterior inferior angle, posterior superior angle, and posterior inferior angle. Anterior superior angle, this one, it is the meeting point of the frontal border and sagittal border. This is known as also brachma, or anterior frontally below the child of 2 years, known as brachma. Anterior frontally, if it is depressed in a baby, it indicates he or she is dehydrated. If it is bulged, it indicates that he or she has increased intracranial pressure. And this is known as anterior inferior angle. It is an acute angle. Internally, it is marked by the groove for middle meningeal artery. We have already discussed about it. And here there will be broad-mass number of 44 and 45 is lies in here, which function is production of speech. If it is lesion, that the person will be unable to talk. It's known as terion. Why it is called terion? Because there will be meeting point of four bones: parietal, frontal, sphenoid, and temporal bone. There is known as asterion. Asterion is the posterior inferior angle, and it is the meeting point of the parietal, temporal, and occipital bone. And now another there is mastoid angle. It is known as mastoid angle, and Posterior superior angle. Posterior superior angle is the marked of posterior frontally in case of child. This posterior frontally is known as lambda. This is the meeting point of sagittal border and occipital border. This is all about the angles, and now we'll go through the internal external surface. This is the external surface. We'll elaborate this. There is a parietal tuber. There is a two parietal tuber, and in between the two parietal tuber, interparietal diameter is most important one, because this one will be counted for the woman's fetus birth process. It is cesarean section. It will be at the cesarean section or a normal delivery. And now this is the parietal tuber, and there are two above the parietal tuber. There is a two temporal line, arched two temporal line, superior temporal line and inferior temporal line, which is more visible in this superior temporal line and inferior temporal line. Superior temporal line will be attached the temporalis fascia and epicranial aponeurosis, and inferior temporal line will be attached with the origin starts the temporalis muscle along with the temporal fossa. So epicranial aponeurosis and temporal fossa. This is all about external surface for borders and for angles. And internal surface. Internal surface, there are marked of some impression for the xyri and grooves for the vessels, and these grooves are, why these are grooves in this bone? Because pulsation of the artery. Then at the superior border there is a half of the sagittal sulcus. Opposite side of the sagittal sulcus there will be formed the sagittal sulcus, full sagittal sulcus. Lodgement will be the superior sagittal sinus, and in this lip there will be the attachment of fox cerebri. This is all about the borders. And here, what is the fox cerebri? This is the dorsal fold. It's a dorsal fold. There are others dorsal folds, and then in the viva, and another question will be asked about the suture. This is what are the types of suture? The types of suture are the serrate suture. Example is sagittal suture, denticulate suture, slandered suture, squamous suture between the parietal bone and squamous part of the temporal bone. Plain variety of suture is between the two palatine process, and wedge and groove between the rostrum of the sphenoid and upward groove of the femur. And there will be another question will be asked in the Bible, what is void? Because as it is a parietal bone, it will be very asked. In front, squamous part of the frontal bone, behind squamous part of the occipital bone, in between two parietal bone. This forms the vault. If vault is not formed in the fetus, it known as encephaly. If it is found in an investigation that during gestation there is an encephaly, the baby should be aborted. And this middle meningeal artery is the most important one, clinically important, because if it is any head injury, there will be severe hemorrhage and it causes sometimes death. This is all about the parietal bone. If you like this video, please like the video and subscribe the channel. Thank you.